Namaskar and welcome to Health Hour with Apollo 24/7 experts. Here we bring Apollo's experts every week to this live session where you can ask all your doubts and queries. We will post your question to the experts and we'll try and bring out an answer. You're watching this on Apollo 24/7's YouTube channel or Apollo's Facebook page or my Facebook page. Please type in case you want your query to be answered only on the YouTube chat box of Apollo 24/7 page so that we can get your answer फ्रॉम द एक्सपर्ट ऑल राइट तो चलिए ये शो पे आज दो एक्सपर्ट आने वाले हैं आज हम बात करने वाले हैं सीजनल इन्फेक्शंस एंड इलनेस के बारे में सीजन ऑफ फेस्टिविटीज इज डन दिवाली इज डन दिवाली के बाद विंटर शुरू हो जाता है विंटर के साथ कॉफ कोल्ड अदर वायरल इन्फेक्शंस एंड वी आर ससेप्टेबल टू लॉट मेनी अदर इन्फेक्शंस तो ये क्या है सीजनल चेंज के साथ जो आते हैं उनको कैसे कोप अप कर सकते हैं सो टुडे वी हैव टू एक्सपर्ट्स लेट मी इंट्रोड्यूस आवर एक्सपर्ट्स डॉक्टर शक्ति आवर कंसल्टेंट from Apollo Hospitals, Indraprastha, Delhi, who is an internal medicine specialist. Being a general physician and internal medicine specialist with experience of 23 years, Dr. Shakti can be consulted for diabetes, hypertension, dyslipidemia, then gastroesophageal reflux, dyspepsia, asthma, allergies, bronchitis, neuropathy, backache, urinary tract infections, enteric fevers, typhoid, dengue, malaria, gastroenteritis, and pneumonia as well. So let's welcome Dr. Shakti to the show. Good morning, doctor. Welcome to the show.
Hello, Jansi. Nice to see you again.
Thank you, ma'am. Welcome to the show again. So it's going to be a seasonal illness today. So I hope we'll have good session of interesting questions and we'll be able to clear some doubts from people.
Yes.
Yes, and today we also have a pulmonologist who's going to join us. Let me introduce you to the other expert on the show. We are having Dr. Srikar Darisetty, who is a pulmonologist, consultant interventional pulmonologist, critical care and sleep medicine specialist from Apollo Hospitals, Hyderabad, Jubilee Hills. And doctor can be consulted for pulmonary critical care and sleep medicine. He has professional memberships in the European Respiratory Society, American Thoracic Society, American College of Chest Physicians, and Indian Chest Society, Indian Sleep Disorders Association as well. He's won awards in the National Quiz, American College of Chest Physicians in India. So here's Dr. Srikar Darisetty. Good morning, doctor. Welcome to the show.
Thank you, Mrs. Jansi. Thanks a lot for the invite. Good to see you today.
Yes.
Thank you.
Thank you so much. So pulmonology, respiratory illnesses is something that bothers a lot of people in this season. So I think you'll be able to help a lot of people today, doctor. Welcome once again.
Thank you.
So here we have Dr. Shakti and Dr. Srikar. You can ask your questions. In the meanwhile, let me just ask a few of my questions. People have already started to type in their questions, but I will take a few minutes of yours just to understand what is the seasonal illness. So Dr. Shakti, ये season बदलते ही हम why do we actually fall ill? Every season change transition में why do we fall ill?
Yes, Jansi, that's a very relevant question because most of us have suffered from it sometime or the other in our lives. So
जी.
what happens is जब season change होता है, so there's a lot of either nowadays especially there's a lot of dust in the air, and I was just looking at the AQI. It's around 400 today. So it's almost more than double. Basically, it is at the danger level. So when the season changes, we have pollen from the flowers, or other such plant derivatives जो कि ऐसे हवा में बहुत उड़ते रहते हैं, और इट इज़ अ दीज आर ऑल फॉरेन बॉडीज फॉर अस. हमारी बॉडी ये इन सब चीज़ों को जानती नहीं है. सो जैसे ही वो हमारे थ्रू व्हेन वी ब्रीथ एंड we come into contact with them, so generally there is what we call an allergic reaction. एक एलर्जी जैसे लगता है, क्योंकि इस सीज़न चेंज में ये चीज़ें ज़्यादा होती हैं एनवायरनमेंट में, इसीलिए सीज़न में ज़्यादा होता है. They might be there throughout the year, but they are more during the change
Correct.
of season. So
Yes.
generally we have this allergy or this reaction because the body responds like that to a foreign body.
Great. So first of all, before I go to Dr. Srikar, let me thank my audience for staying put with us. We were experiencing slight technical difficulty on the show, so we took a few more minutes to start the show. Thanks to the audience, and thanks. I'm seeing a lot of people are typing their questions here. We will be taking your questions very shortly. Dr. Shakti can speak Hindi, so she'll be adding Hindi here and there. Dr. Srikar and I speak Telugu, so we will be summarizing it in Telugu as well for the audience. So, Dr. Srikar, welcome once again. Understanding that winter, post monsoon, winter and the low temperatures cause a lot of respiratory discomfort, and existing illnesses, especially of respiratory illnesses, flare up this season. So, what are the common respiratory illnesses one sees that season heightens there?
Yeah. So, thank you, Ms. Jansi. So, the thing which we need to note here is the season itself, like when the temperature drops, most of these viruses have a fertile environment to grow. If we talk in common terms, a farmer probably grows his crops at this one particular crop at that particular time of the year because that's the best for that particular crop. Rice probably starts off in winter. That's
Correct.
one example. So, same thing when we talk about a cold virus or an influenza virus or any of these, they generally are more rapidly multiplying అంటే మన surfaces ఉంటాయి కదా, let's say our a table or a kitchenette or our mobile phone.
The
So ఇవన్నీ
phones.
exactly. So one the common term we use is fomites and antam. So on these surfaces, let's say maybe in the summer I'll have maybe 2 or 3 viral particles. In the winter season, I'll be having 2 million of them. So ఇవి పెరుగుతాయి కాబట్టి we tend to inhale a higher load of these viral particles in this particular time of the year. So in the peak summer, maybe you inhale a few thousands of them, our body immunity takes care of them. But in winter, when we inhale millions and billions of these viral particles, we get overwhelmed and ultimately we get these respiratory infections. సో మనం
Okay.
ఏం చేయాలంటే మనం ప్రివెంట్ చేయలేము. ఈ సర్ఫేస్ మీద అయితే ఎట్లానే వైరల్ పార్టికల్స్ ఉంటాయి. సో మనం మన జాగ్రత్తలో అయితే ఉండాల్సి వస్తుంది.
Okay, so Dr. Srikar, जो तेलुगु में important factor बोले हैं, I'll quickly put that in English and Hindi for you. You cannot prevent these fomites which are already lying on the surface, but what can we do? While there is so much that we are exposed to, how can we prevent or protect
Yeah.
ourselves? Dr.
So that
Srikar.
starts off from the basics, wherein we talk about first our own hygiene, that is hand hygiene. Try to make sure that before you, because we are doctors, when we deal with patients, we make sure that we sanitize our hands. We have our hand sanitizers. Before we have our meals, make sure you wash your hands in the proper fashion, in a thorough fashion, wherein we scrub our hands for 20 to 30 seconds before having our meals and all that. Adi chesi, this applies to anyone as far as hand hygiene is concerned. So general
Yes.
hygiene measures, and if at all we are going to a crowded place, COVID or no COVID, if we feel that we are visiting a place where the infection load is high, that is a hospital,
uh,
so it's better to put on a face mask.
wear a mask.
It starts off
Yes.
from there, and then then
Very, very important point that we all have learned from COVID is wearing a mask and hand hygiene. I hope our lessons are well inscribed in our heads and we don't lose our lessons. Dr. Shakti, would you want to add how much has COVID influenced our fear or hygiene or our lifestyle? Have we learned our lessons enough?
Jhansi, I was just going to comment that Dr. Srikar has said this thing, but how many of us, I mean, are relieved of not wearing a mask? I mean, wearing a mask, everybody was, I know for a fact, not only patients but family, friends, they were very happy. Oh, अब तो मास्क नहीं पहन, अब तो गवर्नमेंट ने बोल दिया है, अब तो नहीं पहनना. Although we used to tell, I mean, patients coming to the OPD, we always tell them कि एटलीस्ट आप हॉस्पिटल में पहनिए बिकॉज आप यहाँ पर आ रहे हैं, people are unwell around you. So I think we are back to pre-COVID now. People don't like wearing, and they are, sort of relieved that we don't have to wear. But I mean, just to corroborate what Dr. Srikar was saying, that it's very essential to wear a mask and to prevent allergies and cough and cold and seasonal illnesses. So we should
Also a
continue.
responsibility, as a responsibility
Yes.
to protect. Wearing a mask is something else, and also if I have something, let me not spread the fomites as much. A simple mask can prevent getting,
Indeed.
especially if you have some kind of discharge.
Hmm.
Commonly, a lot of people are asking about the common cold, having cold continuously. All these questions that people are asking. I'll get to the questions in a while. But what is इतना क्यों running nose होता है? Why is it that we see common cold and influenza so much in this season? Dr. Srikar, would you just want to add something about influenza here?
Yeah, so influenza, Andy, the thing about influenza and common cold, there's a common, it's like a Venn diagram wherein we have so much of an overlap. But when we talk about influenza, we in fact use the term called as influenza like illness, wherein we do have a fever. There's hardly any influenza, a documented influenza without a fever initially. So we have fever, we have body pains, we have a running nose, we have a sore throat. Common cold, what happens is most of the time it is the term common cold itself, it shows that we can just lead our lives with it except for day one. So day one, usually our fever is less than 100 degrees. Most of the time we won't even feel feverish or lethargic. Then we definitely will not be having body pains, but yes, we'll have a running nose, we'll have a sore throat on the first day, and thereover the thick secretions or chimidi, what we call as mucus, that takes over. Whereas for
Yeah.
influenza, we do have some symptoms which differentiate. So namely a fever and body pains. Okay, and it's like a more severe version. So we should not label influenza and what was done initially for COVID, that it is just like a common cold, we can just brush it aside. No, it needs to be taken as a separate illness by itself and needs medical attention. Common cold may or
Right.
may not require medical attention.
Yes. But Dr. Shakti, what kind of seasonal illnesses are you finding in your clinic at this point, and how are you able to address these issues?
Hmm. Yes, Jansi. So, what Dr. Srikar said that because of the increase in the virus population at this time and seasonal change that you were talking about, so definitely we are seeing an increase in viral illnesses, and every year we do that. Every season change, we see an increase in viral illnesses, and there are around, I think, hundreds of viruses which can cause such a illness, viral illness जो हम कहते हैं, वो जैसे सर बोल रहे थे कॉमन कोल्ड है, कोविड है, फ्लू है. So influenza, covid, these are different kind of viruses that we can test, and we know, okay, H1N1, these are 3 4 kinds of viruses that we can test. बट देर आर सेवरल अदर काइंड्स ऑफ वायरसेस, बहुत सारे और हैं जो जिनका हम टेस्ट कर ही नहीं सकते हैं. सो
बिल्कुल.
एंड definitely most of the time treatment does not change. So as they say, either you treat for 1 week or you treat for 7 days. Any which ways you will get better. So,
Yes.
what I'm trying to say is that viral illnesses as a whole, they are, very common. And even dengue, like you have also
Yes.
this
Yes, we
mentioned,
need to address those as well because
dengue is
the
becoming,
vector-borne
is very,
diseases also are important to take up.
yes, malaria and dengue because of the mosquitoes. So these are also, we are seeing a lot, and we are in fact admitting patients with these illnesses.
Oh, okay. Okay,
Yes.
I will come back to that. A quick thing while Dr. Srikar, you were talking about fever. What is which fever has to be taken seriously and which is not, which is a normal body's reaction. Here's Dheeraj Bajpayi's question from YouTube. He's having fever since 4 days and 98.5 continue हो रहा है. What is a viral fever? जैसे हम लोग सुनते हैं ना इतना, we don't even know what viral fever is, but we use the term loosely so much that I have viral fever. What are the types and how does it present? ये fever को कैसे समझा जा सकता है?
Okay, so first thing I think that 99, I hope it was 99.5. The 98.5 तो normally है, but
98.5 is normal, yeah. So
yeah, so okay, he must be feeling feverish. So viral fever क्या होते हैं? Just as Dr. Shakti has mentioned, there are so many of them. There are like hundreds, thousands of them. Most of the time, we cannot test it by means of a simple means. In the sense that we have to probably send for a more expensive panel wherein we get a list of almost 100 viruses which we can interpret in a short while. So those are you call as a respiratory biofire assay, and multiple names are there for that. So viral fever is just one broad term for it. We use the term viral fever as far as a common man's perspective to state a fever which does not have any other symptoms. Like let's say, agar if I if I had influenza, I'll definitely have a sore throat or a runny nose by day two. So what we usually use as a term as viral fever is probably he just has some weakness and fever, nothing else. He doesn't have a headache, he doesn't have a running nose, no sore throat, no stomach pain, no loose motions. So that is a common term. But most of the times, yes, this fever can evolve into something. The symptoms can start later. So maybe for you don't have to run to the hospital on day one of a fever, and definitely not just get tested because your blood reports may be normal. We can wait until day two or day three, observe the pattern of the fever, take a paracetamol only when you get your fever, document and then take. Don't take paracetamol just 3 or 4 times a day. So once we have, then the doctor will be able to take it on from there. Is it more towards the evening or is it more in the night? Is he shivering when he gets the fever? So these symptoms help the physicians to diagnose better. So yes,
So
by day two or
document,
day three, we need
yeah,
to
which
visit the
very
physician.
importantly, note down your symptoms and the temperature.
Exactly.
Dr. Shakti, here's yet another question. Anamika Sharma 39, I have cold and cough. Please suggest a good medicine. And somebody else is also asking about the medicine. तो मैं जब ये मेडिसिन के बारे में हम लोग सोचते हैं, खांसी के लिए ओवर द काउंटर इतने सारे मेडिसिन है, एंड ऑल्सो पीपल जो पुराने मेडिकेशन में एंटीबायोटिक्स है, we tend to overuse or abuse our medications. What is your take on how can one self medicate?
Jhansi, when a person comes to me with cough and cold or what we call viral illness, so I tell them two things are most important: rest and hydration. So these
जी.
two things, even if you don't take any medicine or you take just paracetamol, and for your body ache or for headache or fever, if you take just paracetamol and even vitamins, they have not proven to have any role. So it is just with COVID, that they were tried, and in fact it was proven that they don't have any role in increasing the immunity. This vitamin C and all, they have been proven not to have any role as such. So basically it is just paracetamol, rest and hydration. So if you're able to do this and you're a bit patient, body will recover on its own. अपने आप बॉडी की इम्यूनिटी काम करना शुरू करेगी. 2-3, गिव इट सम टाइम. मतलब डेफिनेटली जो आप कह रही हैं दैट वी रश इनटू एंटीबायोटिक्स, जिससे कि हमारी इतनी एंटीबायोटिक रेजिस्टेंस हो रही है, जिसके लिए इंडिया बहुत बदनाम है एज सच इन कोट्स.
Exactly.
या
We need to,
सो
we need to do
तो
this campaign against the antibiotic.
यस
हर छोटी सी चीज के लिए इतना एंटीबायोटिक मिल भी जाता है यहाँ पर.
जी
This we
जी.
need to do
एंड यू आर एबल
regulation.
टू buy it without prescription also from your friendly neighborhood
Correct,
chemist.
correct.
So,
Yeah.
Yeah.
what I'm trying to
Let
say is that people
regulations in
just have
place.
to, yes, people just have to be a bit patient, and just give it 2 or 3 days. Body will start recovering. Body has already come into contact with so many viruses in the past. कुछ ना कुछ थोड़ी इम्यूनिटी होती ही है. यस, अनलेस अ पर्सन हैज सम कोमॉर्बिड, जैसे हम कोविड में बात कर रहे थे, कोमॉर्बिड कंडीशंस में पेशेंट थोड़ा ज़्यादा सिक हो जाते हैं. So then,
Exactly.
you should understand when to go to the doctor. If you're not getting well in 2 or 3 days, जैसे सर ने बोला कि फर्स्ट डे तो आपको बिल्कुल ज़रूरत नहीं है, आप पैरासीटामोल ले सकते हैं. सो आई थिंक just doing these 2-3 things will be very useful. And
Yeah.
drinking and hydration means at least 3 to 4 liters to flush out
हाँ.
everything. Pani, or if person is not diabetic, electrol, glucon D, all these things really help the body. Just hydration is important.
Yeah. Srikant Palukuri garu. మీ క్వశ్చన్ ఇక్కడ డాక్టర్ శక్తి ఆన్సర్ చేసేసారు. సిన్స్ పాస్ట్ 4 days he has cold and cough, suggest medication. I think that's what he should do. Dr. Shakti has given you tips to follow. Right, next question to Dr. Srikar. Sean David is asking, can you please talk about vaccinations like influenza, pneumonia and hepatitis with seniors, for seniors with diabetes? Yes, I do
Hmm.
have seniors, and annually we have a flu shot and a pneumococcal vaccine that we give to our parents as well. Would you want to talk about the vaccinations?
Yeah, certainly. So, two vaccines are regularly prescribed by me. That is the influenza and the pneumococcal vaccination. Influenza vaccine is an absolute necessity. It is not like our, polio vaccine or something which we have taken during our infancy and childhood and don't
Once.
require it again. Yeah. So, yeah. So the thing about influenza is because we have the virus keeps mutating or it keeps changing every time. You get a new strain. It's like, putting on a new garment and fooling the person, fooling the body's immunity, I mean to say. So we
Correct.
need every year we need to top up our immunity by taking a vaccine. So that is about the influenza. However, pneumococcal vaccine, we have got two types in that. So we start off with the first serotype, and we normally give it at the in the early ages itself, that is in childhood. In fact, America has, for example, administered the pneumococcal vaccine to all its children. So they develop what is called as herd immunity, and a population అందరూ ఇప్పుడు ఆ strains of pneumonia కి immunity develop చేసేసారు.
Correct.
Then we have got this 23 serovar vaccine. So that needs to be given once in 5 years. Pneumovac 23 and అంటారండి. That doesn't need to be given every year and needs to be given. In fact, if I go into details, it's a little more complicated, but for conventional terms, we can remember that the pneumonia vaccine has to be taken once in 5 years. Okay,
Okay, even
irrespective
for
of the
seniors.
age,
Yeah,
even
who
for the
has to
senior.
take this? Who has to
Uh,
take this, and from what age that influenza
yes.
shots have to be?
Yeah, previously the convention was it was only for the senior citizens above 65, but presently or slowly the guidelines are pushing it towards all age groups.
Hmm.
Okay.
Towards all age groups, the 19 to 64-year age groups. More so, there are some, as you said, senior citizens. By this, I assume that they are already having some, at least a cardiac disease or a lung disease, diabetes. Okay, and for a younger age group with certain conditions, let's say they have a ear implant or they had some sort of infection in the brain in the past. They have some immunity related issues. So, Ilan even at the younger age group, they are supposed to be up to date with their vaccines.
Great. So, Dr. Shakti, here's a question about somebody suffering from typhoid. So, let me quickly, नाम उनका नहीं है, उनका typhoid है, fever continue हो रहा है. So, क्या कर सकते हैं? I did lose the name. In the meanwhile, would you please start answering the question, please?
Jhansi, typhoid, we were just talking about this antibiotic resistance. So, typhoid is becoming very resistant. So,
This
we
is,
have
sorry,
to,
Sai
uh,
Krishna Devara. He's
okay.
persistent typhoid fever है इनका, and how can I quickly recover?
जी सो यही मैं बता रही हूँ कि क्योंकि एंटीबायोटिक रेजिस्टेंस आ रही है टाइफॉइड में काफ़ी ज़बरदस्त सो वी हैव टू गिव एटलीस्ट नाउ वी आर गिविंग एटलीस्ट 2 antibiotics and many times typhoid is not detected in the blood. Generally it is diagnosed by blood culture, but
Okay.
almost 50% of the time it is not diagnosed, either because person has already taken antibiotics or because uh, the bacteria itself is quite difficult to grow. So but generally first week में blood culture बहुत कम लोग करते हैं, डॉक्टर्स भी नहीं करते हैं ज़्यादा बिकॉज एक्सपेक्ट नहीं करते हैं, मे बी दे आर थिंकिंग वायरल है, डेंगी है. So he has to consult a doctor because he has to be given antibiotics. Sometimes, in fact, Jhansi, I would like to tell you and Mr. Krishna, sometimes even tablets don't work and you need injection. Yes, so nowadays, so that is why without consulting, without a doctor examining him and going through his lab results, it will be difficult to prescribe anything like this. So he
Sure,
should
sure.
go for
So
a physical consult
yes, the
and take
doctors
preventive.
can be consulted on Apollo 24/7 app as well. So Sai Krishna Devarapati Garu, please go ahead, get yourself consulted and get the right treatment, which is important. Yeah. Next
Yes.
question I'll move on to is children. And Ramesh Rawat ji पूछते हैं, my baby falls ill to seasonal changes. And also Pallavi Kiran, 31-year-old hai, but a 2-year-old baby has cough and cold. How to cure that? So children are also susceptible. So,
Hmm.
Dr. We see a lot of children falling ill in this season. Is it different with children, or how do we address this issue?
Okay, so children, they are bound to fall ill because their immune systems are still learning about their external environment. But more so, we also have something called as the hygiene hypothesis, wherein too much clean an environment can just push this whole thing into early childhood. So the toddler or a child is anyways going to put stuff into his mouth. It may be a pen cap, it may be food which is on the floor. So we need to take the necessary precautions. I'm not saying we should maintain a dirty environment, but we can accept the fact that children do get upper respiratory infections at a little higher rate initially when compared to adults. But yeah, the basic precaution is this. We, just as Dr. Shakti has mentioned, we don't over medicate, don't start off antibiotics right away, don't, just start giving them azithromycin or something. We need to, look how high the temperature is going. If it is clocking more than 101, yes, the pediatrician needs to be consulted. But if the child is not able to breathe, in fact, if he's breathing with the mouth open or something like that, then simple saline nasal spray, that is a physiomer nasal spray, can be, given to the child, or saline nasal drops, and at the same time some steam inhalation. Steam inhalation, it should not be
Very
directly directed to the child. It should be kept little far away so that the whole room is humidified, and
Okay.
paracetamol for fever. So, I mean, this basic measures are enough. So, when a child gets a cold or cough, we shouldn't get panicked right away. It is bound to happen for the initial 2 to 3 years. So, after that, it peaks when the child has entered his pre-primary years, because that's when they come into contact with other children who already have multiple respiratory infections. So, that's all. The
Yeah.
basic measures apply to children.
Yeah. Dr. Shakti, Nancy Mohanty lives in Bangalore. And while you are in Delhi, we understand that Bangalore in south has the coldest weather, and Delhi, of course, has irrational weather throughout the
yeah.
year.
Yeah.
So, the seasonal impact that we're talking about, Nancy has a 7-year-old and she has a cold continuously. It cures and then comes back each time. We are staying in Bangalore, weather is quite bad here. So everywhere, I think we are facing this seasonal
This,
kind of
yeah.
change.
Gee.
Yeah. So how do we help them?
Jhansi, I think we should encourage more climate change conferences so that people can take steps to decrease the pollution and the
I
governments
know.
can act. But
Yeah. Yes.
on a serious note, Jhansi, I mean, of course, I'm sure if something can be done. I mean, all of us are falling ill because of this only. बहुत ज़्यादा, like we are having irrational weather as you're saying, but it's not only here, it's everywhere, even other parts of India. And this flooding in Bengaluru, I don't know how much it happens every year. I don't think it happens every year.
No, no, it's not
This
an every
time,
year thing.
yeah, this
Alarmingly,
time it
it
was
is.
quite bad.
It
Gee.
is, yes. Yeah. So we need
So
to also think about the larger climate change issue in
yeah,
while we are experiencing these kind of seasonal illnesses, which are
yes.
also pandemic kind of illnesses that we are seeing.
But
Yeah.
definitely, I think this baby or as somebody who is having recurrent illness, बार बार उनको अगर हो रहा है, so they should even I mean, Dr. Srikar will also agree with me that ultimately they can develop a sinus problem also. So, and then, that has to be seen by an ENT specialist, and, they have to be given nasal sprays so that the passage can be, अगर बार बार उनको cold हो रहा है, तो उनको एक ENT कंसल्ट ज़रूर करना चाहिए ताकि डॉक्टर चेक कर लें for sinus and do an x-ray for sinus, and because that can be has to be treated a bit differently.
जी बिल्कुल बिल्कुल. Yeah, one quick question again. I think a lot of people are asking questions. So Kartikeyan is asking 50-year-old father here, having cold frequently throughout the year, and whenever he bends the head while cooking, or cooking smell, severe running nose. Okay, let me understand it this way. Whenever they bend their head, cooking smell, severe running nose. Let me
Yeah,
place
got
it
it.
that
Maybe the
they are
cooking
having.
smell is like an allergy for it for him.
Huh,
Maybe,
okay,
ha.
maybe.
So again,
Yeah.
actually, Jhansi, this is going in favor of a sinusitis. If you bend your head, so it means that sinus may be filled with some fluid which is unable to come out. So we need to give nasal sprays for that, and is going in favor of sinusitis. So again, they should go to an ENT specialist.
Yes, yes. So yeah, heart attack. Okay, heart attack. Okay. Devendra R. What can I do? My EF rate is 43% after a heart attack. What can I do to improve? Now I'm doing a job in cold, hilly place, Tawang mein hai. So yes, cold place, and then EFR is 48%. Dr. Shakti, would you want to add here?
Hmm. Jhansi, I think for each of us, a healthy lifestyle, works very well. Even if his EF is 45%, that is, his pumping of the heart is lower than normal, he can go for walks and he can eat healthy. So, wear a mask. If I don't think it will be very polluted there. I mean, if it's, an altitude, air is, much fresher.
Yeah, no,
So,
I'm not having planes have here. Yeah.
yes. So, I don't think anything extra is required except take his medications and go to for his regular checkups. So, I think he will
Great,
do
great.
well,
I think you're fine.
if
Yeah,
not in Delhi or in
Devendra,
a
you will be fine.
polluted city.
Yes. Dr. Srikar, here's a question for you. Mr. Ajay, Ajay ka ho gaya. So, where did I lose the question? All right. Breathlessness, tiredness. Father has started having breathlessness and tiredness issues last season, and due to that, he's not able to sleep properly at the night. 62-year-old है अजय जंगवान का क्वेश्चन है.
Okay, so breathlessness and tiredness. The problem is these two symptoms are a little vague, and most importantly, two systems can have both these complaints, that is, the cardiac system and the respiratory. So, we need to get a little more, few more details here. That is, what were his past ailments? Is he a hypertensive? Was he a diabetic? Did he have any cardiac issue? And the other important thing which we need to see from the respiratory point of view is what is his occupation? What all is he exposed to when he goes to his workplace? Whether is it a
Okay.
chemical or dust exposure? And thereon, the next more important thing is whether he's a smoker or a non-smoker, and
Okay.
what other allergies has he got. So based on this, if we try to cross analyze, first thing we need to separate this breathlessness into that being of a heart related origin or a lung related origin. Sometimes both can coexist. So when we say breathlessness in this, yes, if in the absence of fever or any signs of an infection, if this breathlessness has been around for some time, we need to evaluate. There are some tests which helps us differentiate these two organ systems. Of course, even the kidney also can cause these symptoms of breathlessness, but of course there'll be some swelling of the feet and all the other symptoms. So we need further evaluation before we can go for a generalized treatment as far as the
Correct.
breathlessness and tiredness is concerned.
Definitely, and Apollo 24/7 is always there to help you, Mr.
Sure.
Ajay Jang. Yeah. Dr. Shrika, one quick question of the vaccine. Pooja is asking, is it good to take a flu shot before the change of season?
Yeah. So the vaccine for that particular year is generally released by the end of June or the beginning of July. So we get our vaccine like 2022. It's dated by that particular year. So if I say my Influac, the quadrivalent flu vaccine, which was released in 2022, comes at this time of the year. So yes, it is always better to take the vaccine well in advance, the minute it comes into the market. Because once we give a vaccine, this is not like an antibiotic. It's going to take a couple of days for the body to mount a resistance or to develop a resistance to the organisms for which the vaccine is supposed to work. Let's say I'm giving you four viruses in the form of a vaccine, a weakened virus, and your body is supposed to develop resistance to these four viruses. The body is going to take a couple of days. So let's say I give the vaccine very late. Now the flu season has started. If I give it in September, there's not enough time for the body. If I get infected by
Oh,
these four
right.
viruses in this period of time, then it's not going to work. So I need to give it. It's always better to take it at the initial start itself before the season starts, so that you've
Okay.
given your body enough time to develop a response.
Great. Thank you so much for clarifying that. Dr. Shakti, Mr. MP Chowdhury is asking this question. Daughter's 38-year-old. She was suffering from dengue and her platelets are not increasing. They are maintaining around 160. There's no fever since last 4 days. She's feeling okay. So how about, do they need to worry about the platelet count?
No, Jansi, it's absolutely normal. Above 150, we are very happy. And so basically, dengue is also a viral illness, and like all viral illnesses, it is around 8 to 10 days. So, depending on the day, number of days which have passed for this lady, so I think that she's already almost at the end of her illness because she's feeling better and everything. So, above 150, we are very happy. So, I think nothing to do. Again, hydration and rest.
Ah, good, good, good. So yes, and Karthikeyan G's question is coming up next. Dr. Srikar, advice for severe throat dryness. So that's also a seasonal kind of infection?
Not isolated throat dryness. Throat dryness can be accompanied with some other symptom. So, how exactly did this start? Did he have a preceding cold or a cough to start with, or did he have a fever? Is he recovering from a sore throat? Okay, so these are the
Okay.
common things which we have to,
Okay.
first. See.
Yeah.
Other than
In
that,
case
just as what Dr. Shakti said, hydration.
Karthikeyan, if you
Yes.
want to add a few more details that doctor's asking, I will take up your question in a short while. Please do type your questions there. All right. Next question. I want to Sandeep Ghosh's question. I have a recurring dust allergy so much that whatever I do, even house dusting or even I open a cupboard with a strong smell, I start sneezing and block nose. Is there a way to permanently take care of it?
Yes. Yeah,
Dr. Srikar.
I just come to this aspect. Now, when we talk about a dust allergy, so dust is once again just a blanket term for like millions of allergens, millions of them. It could be allergy to a dust mite, it could be to a cockroach feather. This is just a few of them. It could be some, dog hair or a cat hair. Everything and anything is dust. So if you feel that if the gentleman feels that his allergy is way out of proportion, wherein he needs to take medication on every single day to control these allergies, the best way is to get a allergen panel testing. It is commonly called in most of the hospitals. We have a food and inhaled allergen panel testing. So that
G.
gives us, and this is area specific, as Dr. Shakti would definitely agree. Like, for example, Vallabhai Patel Chest Institute in Delhi
Mm,
has got a
yes.
complete panel like this, but that is specific to the plants and the common, allergens in
The
Delhi.
geographical plant, the area that we live
Yeah.
in.
So a gentleman who's going to reside at Delhi should not be getting an allergy test done in Hyderabad. Okay, it is
But
specific to the area where you're residing. So then you decide what, and we have got something known as immunotherapy. Let's say the person is allergic
Mm,
to dust mite. That's a small bugs which are found in these dusty areas. Then we can administer immunotherapy, wherein we start off with a very low concentration. Let's say 0.00001%. We start giving them injections, and then over a period of few weeks, the person is able to slowly tolerate even a 0.1% concentration, which means a very dilute to a very concentrated. Ultimately, at the end of a few weeks, the person is free from the allergy. But it is a long process. We need to know what the person is allergic to. It should be a very specific treatment.
yes. So from allergy to let's move on to the medications and their efficacy. A lot of people are asking, Sri Rajni is asking, does medicine really help in reducing cough and cold, Dr. Shakti? One. And Nandini Verma is asking, 34-year-old female, as a breastfeeding mother with a viral infection, what precautions should I take while taking care of my child, and will medicines impact? And there was somebody else who was asking, who's trying to, Parkash Gupta. She's trying to conceive and she has cough and cold. उनके लिए मेडिसिन सजेस्ट कीजिए जो मुझे फर्टिलिटी का असर ना पड़े. सो डू मेडिकेशंस हैव साइड इफेक्ट्स? The underlying question in all these questions is, what kind of side effects do they have?
Hmm. So, Jhansi, generally, besides paracetamol, we are prescribing allergy tablets. So, there are a few allergy tablets in the market, and they are also available over the counter. Many people, I'm sure, even you must have taken cetrizine sometime or the other. I don't know if you've heard of it, cetrizine, levo, Allegra.
Lucid,
Yeah,
yes, yeah, a lot
yes,
of by many names that we get them, and very
yes.
easily available on the counter. Huh?
Very easily available. So, personally, I think they are not bad to take. Like antibiotics, we don't want to give, but allergy tablets we have to give. Generally, we have to give because the allergy reaction, जो मैंने शुरू में बोला था कि वो फॉरेन बॉडी हमारी बॉडी में आती है तो एक एलर्जी रिएक्शन होता है. So that allergy reaction is suppressed by these medications. So, I think you mentioned one lady trying to conceive. So,
Yes.
generally, these allergy medicines are safe to take, but we should try to avoid all medications in the first trimester or before conception. Generally, we try to avoid, but most of them are safe to take. बिकॉज यू सी
Okay.
झांसी ऐसे बहुत ज़्यादा ट्रायल्स नहीं होते प्रेगनेंसी में. यू कांट डू दीज ट्रायल्स एथिकली. आप
Correct. Correct.
मीन्स तो वी डोंट नो कि कभी कभी. सो दैट इज़ वाई वी से ट्राई टू अवॉइड, बट इफ हैज़ टू टेक देन हैज़ टू टेक. अगर बहुत
Yes.
ज़्यादा सिवियर रिएक्शन हो रहा है. And I've forgotten the other one question was again this
Yeah,
allergy
one is,
tablet.
are they effective enough? Are the cough and cold medicines
Yes,
effective enough? Second is,
yes,
I'm breastfeeding, and
yes.
will they have impact on
Breastfeeding
me?
and pregnancy, same answer. Like you should try to avoid, but if required, you can take. They are what is said that they are safe to take in pregnancy and breastfeeding. Only
Yes.
one more point I would like to add for the lady who wants to take. So sometimes we are seeing, and sir will also agree that we have to give them for long period now. For example, more than 1 week, 10 days. Earlier we were giving for 5 days, 7 days, but now it's more than 7 days we have to give. Many times people are not getting better in a few days time only, like we used to see before. So
I,
sometimes you're
I
prescribing for
add,
2 weeks,
can I
four
add a few more
weeks.
questions here while you're answering the same question?
Yeah,
Lot of them I see are saying कि मेरा कम नहीं हो रहा है, 7 दिन से ज़्यादा हो गया है, 1 month से ज़्यादा हो गया है, मेरा कंटिन्यू हो रहा है, मेडिकेशन लेते हैं तो थोड़े दिन कम हो जाता है, फिर से वापस आता है. I'm seeing that this is a common cold and cough which doesn't,
get better.
they're not finding relief for a longer time. It's
Hmm.
coming back.
Yeah. So, yeah, I'll just add on to this. This is
Yeah.
what Dr. Shakti Madam has mentioned earlier, the difference between cold and sinusitis. So, some of these questions can be answered based on that. We need to remember the cold, which we have all faced during our childhood and later on in early adult life, etc. Is okay. It starts off. You feel not well. You have a slight sore throat. Day one, dripping or a running nose. We can't find enough hankies or handkerchiefs or tissues to wipe our nose. Thereafter, it starts becoming a little thicker. So we go to the wash basin and sneeze out. This is the usual trend, and within a period of 7 to 10 days, it goes off. We may have a little bit of a cough. Now, what happens in sinusitis? It starts off in the similar fashion. It starts off with a cold and a running nose, etc. Then the symptoms start coming down a bit. But then, after coming down on day 5 or day 6, they start increasing all over again. So, this is when the sinuses have got affected. So that's how we differentiate between a cold and a sinusitis. So most of
Right.
the time, the first thing I'd like to advise to a person who is not a habitual sufferer of sinusitis, which means he never had the problem of sinusitis, is do not blow your nose too hard. Madi gettiga cheelokodu. If you do that in a very violent fashion, there's a high chance that the infected secretions or whatever it is ultimately go and enter the sinuses. Okay,
Right,
so do
right.
not.
So don't blow too hard. Yeah,
Yeah.
that's the
So,
important
I mean,
suggestion I
you
take away.
try to sneeze out something, let it come out, and then wait. You can always try and sneeze a
Right.
little later. Do not go on
Yes.
persistently sneezing. That would lead to a sinusitis a little
Yes,
later.
and yeah, one general precaution: how can we minimize the impact of weather change and avoid colds and coughs? Lalit Gupta, 43. Does immunity have any role to play, and how do I increase immunity? This is my question I've added here. And one more: Nancy is asking, can we do the home remedies for cough and cold like tulsi and honey? Dr. Shakti.
Jhansi, I'm not very much in favor of home remedies, unfortunately, because of this kada business that we saw last year. I, we had a lot of patients who had actually increase in cough
Arey
because
Baba.
this kada, this thing that they
Kada
used
is
to,
kashayam for the
that
South Indians to
I don't
understand.
know.
North India, it's called kada. In South India, it's called kashayam, or
Yeah.
Yeah, very
ha.
something very potent. I don't know how to describe it. So they add a lot of these spices and masalas so that I don't know, but it never soothed any throat, I think. And a lot of people were taking it for several months, and just to under the impression that they will prevent COVID, but nothing of that sort happened. So basically, Jhansi, what I'm trying to say is there is no medicine to increase immunity. हमारी
Right.
इम्यूनिटी एक तो इनबिल्ट होती है, जो आई मीन बचपन से हमारी एक्सपोजर से भी होती है, और एक इनबिल्ट होती है हमारी इम्यूनिटी. सो वी हैव टू जस्ट have a healthy lifestyle. We have to eat healthy, exercise. Like I tell all my patients, body की circulation अच्छी करनी है, which means that oxygenation of all, of every part of the body should be good, so that working is good, and in the end immunity becomes better.
Wonderful.
It is not, it is something like medicine has not been able to, what do you call, achieve that, increasing the immunity. और आजकल बहुत सारे और ऐसे products भी आ रहे हैं. You are talking about home remedies, which I discourage patients to take, because
Yeah.
even if they, because we can't, we know, for example, paracetamol tablet है, उसके एक इफेक्ट है और एक साइड इफेक्ट है, मुझे पता है, बिकॉज वो आपके ट्रायल में प्रूवन हो गए, एक स्टडी हुई और उसमें हमें पता चल गया, लेकिन हमें तुलसी का नहीं पता है. सो हाउ इट कैन इफेक्ट एनी वन. I mean, there is we can encourage Ayurveda, but we need to have a science behind it also. We need to prove that science. Basically, that's what I'm saying. कि हम ले तो सकते हैं, अगर हमें हो सकता है कुछ प्रॉब्लम ना हो, बट किसको प्रॉब्लम हो जाए आई डोंट नो. And we have seen with lot of herbal supplements, people get liver problem and kidney problem. So we have seen lot of patients, and then after a lot of, I mean, they, some people don't even feel that it's a medicine or it's a supplement. So many times they don't tell us, and we are at a loss to So even other supplements, so-called supplements, immunity supplements in the market, for
Yeah.
example, coenzyme Q, then these DHA, AHA, and all these gimmicks. So please don't take them. There is no proven study which has said that they will improve your immunity. You know, nothing will improve it. Only your own lifestyle, what you
Yes.
eat, how much you
And how?
exercise,
That's
yes,
it.
and
Yes.
how
All
happy
right.
you are. Like, you are looking
Ah,
very happy and pleased with everything, and I'm sure you will have a good immunity.
thank you. All right,
Yeah.
let's all
Yeah.
be happy
One
and
more.
improve our immunity. Yeah, Dr. Srikar, one quick question before we start to wind up. Vijay Wazirani and also Ruchi, both of them are asking about, and also Mohit is asking, rhinitis ke बारे में पूछ रहे हैं. So would you quickly want to add, and also, yeah, Vijay Wazirani, what's the best way to treat recurring reactive airway disease? And Bangalore में जो रहते हैं, tree pollen के बारे में a lot of people are asking.
Yeah. So we'll start off with this rhinitis thing. Rhinitis, the common term for any inflammation within the nose. So that means a common cold. So either he can have a blocked nose or a running nose. So if at all we have the symptoms of a viral infection once again, wherein this running nose had started overnight or maybe a day later, then we go ahead with the usual remedies as was discussed earlier. But there
Okay.
are some other things which we need to note. And I also wanted to, when I talk about this rhinitis part, I just wanted to add on to what Dr. Shakti madam has said about home remedies. What happens here is, like, let's say a person has rhinitis, it is not just a common viral cold, it's not coming down. So if you continue to use these home remedies, whether it is turmeric or honey or tulsi, whatever was mentioned, you may just be postponing your appointment to the doctor. So, because that may provide some symptomatic relief, that's it. It's not going to cure the condition. So, if it is going on for more than 7 days, that means your body is trying to tell you something, that it is something out of the ordinary and you need medical attention. The first thing,
Okay.
what as Dr. Shakti has mentioned, is visit your ENT surgeon. If it is not coming down within 7 days, as should be the case with a cold, even a sinusitis, for example, as I told, it comes down and then restarts all over again. Sinusitis needs to be treated first by an ENT physician. Okay,
Right,
so that
right.
is about. And the second question was about seasonal
The
allergies. So about
allergy.
reactive airway disease. Once again, reactive airway disease is a common term which encompasses asthma, then allergic bronchitis, this whole things which involve some amount of a cough with or without phlegm production. Temida or Balgam anantam kadama, that those things are the common, that's the blanket term for it. Now, yes, there is a lot of tree pollen allergy going on. So, unfortunately, I know it sounds a little boring, but the first advice is prevention. So, which
Huh.
means if you are going to the park, there is no way you can prevent an airborne allergen from hitting you. If you have a food allergy or a medicine allergy, for example,
You can
even a
avoid it.
you can avoid it, but there's no way you can prevent a dust allergy, or you cannot prevent it to enter your lung. So irrespective of how many air purifiers we use, we cannot
And how
prevent,
about
we cannot stop it from entering. So మనం ఏం చేయాలంటే we should make sure that we prevent it. So starts off with a face mask. So once again we can go back to that, wherein if it's very severe, wherein he just goes there and he sneezes for like half a day, then it's always better to go for a allergen testing. He could be allergic to maybe rose pollen or hibiscus pollen, birch pollen. So then we can start immunotherapy again.
okay,
So
done.
this is the common drugs which we are giving are the anti-allergy pills, as madam has earlier mentioned, that can be taken. But that once again there is a limit for it. Like if we are not getting better on those drugs in like 7 to 10 days, that's when we need to look further. There may be some other
Other.
allergen which we are not familiar with. Most of the times, I always advise or I ask my patients three other questions: is any construction work going on in the vicinity, nearby or within your house, any painting work, and any damp or wet walls in the house. So because that molds or the fungus unknowingly, especially we are just living in an air conditioned environment, those fungi can just worsen our airway disease and we won't even know what's wrong.
Exactly, exactly. Living at coexisting with them literally. Yes, Dr.
Yeah,
Shakti,
yes.
thank you for your time, and I'll have to wrap up now. Quick top tips to deal with the seasonal changes and how do we take care of ourselves.
Okay. So, I think we should continue wearing our masks, eat healthy, exercise regularly, and manage your stress and be happy and stay happy. And lastly, consult your doctor if you cannot understand what's going on. Thank you.
And Dr. Srikar, now I want you to actually add few important tips, especially people recovering from COVID and any other respiratory illnesses. How do they manage their seasonal impact?
Yeah. So people recovering from COVID, I mean, it's pretty much the same thing because you have recovered from a viral infection. There is a high chance of your immunity still being a little on the lower side immediately after recovering from COVID. So try not to go to public gatherings and places where you're bound to get reinfected. There are many people who have recovered from an influenza and COVID or something like that and ended up with another pneumonia a few days later. Okay, so we need to give our body time to heal. Just like we have an injury, we you won't work out or exercise when you have an injured hand. So in a similar fashion, that's one important point which we need to know. And as far as allergies are concerned, first thing is please recognize your environment. If you are coughing or sneezing all of a sudden, try to look around you and try to pick up what has caused it. Is it because a vehicle with a diesel vehicle or something has passed by, or is it because you have just entered a park, or is because you have played with your dog? So these are some of the examples. Try to know what is causing it, rather than so that will make it a little easier for us to advise you on how to go for a preventive steps, basically.
You. Thank you, Dr. Srikar and Dr. Shakti. It was a great session. Thank you so much for spending our Sunday with us. Both of you are coming in from the hospitals. We understand you're on duty, but this also was a great session. Thank you so much for helping our queries and questions. Thanks, Dr. Shakti. Thanks, Dr. Srikar.
Thank you. Thanks,
Thank you,
Thanks.
Lakshmi. Thank you.
Thank you. Well, that was our session with our experts, and here are coupons that we are giving away. The first one that we're giving away today is First VC. Use this coupon on Apollo 24/7 app. You can download the app and use this coupon. You get a flat 150 rupees off on the first online doctor consultation. So go ahead, download Apollo 24/7, where you get entire Apollo range of services in just one app. And the next coupon we are giving you is First 3. Use the code First 3 to get flat 25% off on the online medicine orders. This is valid on the first 3 orders that you order on Apollo 24/7. So order medicines direct from Apollo on Apollo 24/7. Also, to the exclusive viewers, we are giving you of Health Hour, we are giving you an exclusive coupon that is HH247. So please use this coupon code on Apollo 24/7 app to get 199 off on online consultation with Apollo doctors and 20% off on medicine orders. In addition to the earlier coupons that we gave, this is an exclusive coupon that we give away for the Health Hour viewers. And to all the regular viewers who participate in our health quiz, to give you a cue that we are not going to have a health quiz today, and we'll see, in case we'll get back the health quiz, we will let you know, but today we are not going to have a health quiz. Next week we are going to talk about Ghar Ghar Ki Kahani. हर घर की कहानी है हाउ टू फीड किड्स. यंगर किड्स को हम कैसे फीड करें जो नॉटी होते हैं, नोटोरियस होते हैं, नैगिंग होते हैं एंड टैंट्रम्स थ्रो करते हैं. How to take care of their feed time, how to give them nutritious meals if they're not eating well. We are going to have a pediatrician and a dietitian as well. Join us 6th November 11 a.m. on Apollo 24/7 YouTube channel, and we shall bring you 2 experts to ask to answer your queries. Take care of yourselves. Please wear a mask and keep your hygiene up always. Namaskar.